Locate all the equipment that you will need for the pressure setup in your stave cupboard. You'll need a 500cc saline bag, a pressure bag, the monitor cable, and the actual Arterial or CVP setup. Okay, we have all our components here ready to go. I'm just going to put the monitor cable away here for a second and open up my IV bag. It's 500cc saline. This is our pressure setup, and you can actually use this for both CVP or Arterial. There's actually a sticker in there you can put that signifies that. That's the transducer in the center. This is the connector where you'll actually hook up your cable that goes to the monitor. There's a zero port, the white port there, that you use to zero your line. And there's a secondary stopcock there, and if you have an Arterial, you can actually draw some blood out of it, and they'll do that in the ICU usually. And of course, this is your drip chamber. It's important to get all the air out of your 500cc saline bag. So you should spike it and then just burp the bag, get all the air out of it, and then just re-spike it. So we want to put the saline bag on a pressure bag or a femoral pump. I want to put the stopcock to the open air part. It'll block that off, so it'll allow us to pump this bag up to 300 psi. This will allow this system to have a constant 3 cc per hour fluid drip that'll keep our line open. Just so you know that there are different setups for a femoral line, and those actually go with 6 cc's, but the ones we have are 3 cc's. And if you have problems pumping it up, you might have turned it the wrong way. You'll notice that it's ready to go when you see the green in your pressure column there. Okay, we'll go ahead and hang our bag on an IV pole. We need to flush the system, so I'm going to turn the stopcock off to the patient, which is on the right on this picture. I'm going to pull the little flush rubber piece there, and you can actually see fluid coming out of the three-way stopcock. Once it's out of there, it's nice, all the air's out. I'm going to go ahead and close it off. I'm going to continue flushing down the line to the second stopcock nearest to the patient. I'm going to turn that one off to the patient as well, and go ahead and get that line totally flushed and primed. And then close both of them off and make sure and flush all the way down towards the end so it'll be ready for the patient. This is the connector to the monitor cable. It can only go one way. And I'll go ahead and plug that in. And I'll take the other end and plug it into the far left module. That's the one that corresponds to the Arterial on our monitors. If the Arterial is not on, it'll actually turn that section on automatically. If you shake it around, you can actually, the transducer, you can actually see some tracing. You know it's working. So to zero your ART or CVP line, you'll turn the stopcock off to the patient. That's to the right there. And then you'll open up this stopcock and you'll go push 0 on the monitor. And then you'll choose which one, CVP or ART line. It'll make a set of 2 beeps a few seconds apart. That'll tell you it's 0. You close the stopcock off to the air and put your cap back on. And you want to give it a couple of good flushes. By now you'll be able to actually see a good waveform. Here's a close-up. I push 0. And then it gives you a choice, 0 AVP or CVP. Here I'm going to do arterial blood pressure. It'll make the 2 beeps. And after the second beep, it tells me I'm ready to go. Of course, when we're zeroing, the transducer needs to be at the phlebistatic axis. That's the intersection between the mid-axillary line and the nipple line. And that's actually where we want to zero and keep our transducer. If it's higher, it'll show a lower pressure, and if the transducer is actually lower after it's 0, it'll actually show a higher pressure. So we want to make sure that that's secure, and that'll give us a good reading.